Fantastic. Okay, so we're on live on both Facebook and on YouTube. Now, today, as usual, on the coffee chat, nice and relaxed, I talk a little bit for about 5 or 10 minutes of today's subject, which is back, butt, and vagina pain pre and postnatal. And we're going to talk about the exercises that you can still do during your pregnancy that will actually help it. Now, I'm not going to show you all the exercises because this brand new module is going to be added into our Fit to Birth Mum program, which is going to be amazing during your pregnancy. And then we're also going to add a postnatal segment in. Okay, so if you've not been to the website before, go check out pregnancyexercise.co.nz. There is 400 blogs on the website, all relating to pre and postnatal fitness and health, and make sure you tell all your friends. Okay, so pain in the butt, the back, and shooting pains up often through your vagina is generally caused by those hormones, those pesky hormones that are released during your pregnancy. And it's not just relaxin, it's progesterone as well. So there's a group of hormones that causes the ligaments to relax. And we need this because it helps the body grow to adapt to the pregnancy. We need to make room for the pregnancy, so everything needs to stretch. But unfortunately, this can come with some issues, and we can often get a lot of back, pelvis, and pubic symphysis pain. So the initials that you may often hear are SIJ pain, which is sacroiliac joint pain. SPD or PSD are exactly the same. Symphysis pubis dysfunction or pubis symphysis dysfunction. Okay, now what happens is you've got your sacroiliac joint at the back here, okay, which is here at the base of your spine, and the pubis symphysis joint, which is here at the bottom of your pelvis. So you've got your pelvis here, and then you've got the joints at the bottom. Now what happens is, with those ligaments getting nice and soft, is it starts to stretch and open, okay? Same with the sacroiliac joint at the back, so it stretches and opens. Now, if you can think about it this way, okay, because we need to know that ligaments, muscles, okay, can be painful, not just when they're short and tight, but when they're long. So if you bend your fingers back, that hurts, doesn't it? okay, but then after a time it goes again, but if you pull them a little bit more, it'll hurt again. So that is what's happening to those joints at the back. So what we need to try and do is stabilize the joints, okay? We need to we can't, eradicate what's going on, because it's needing to happen for your pregnancy. Your pelvis and your hips are getting wider to accommodate for baby growing and to hopefully, and then have birth your baby. So everything does need to separate. So what we need to do is try and create a stable environment by improving glute strength and core strength, okay? Because glute and core strength stabilize your pelvis. So to prevent this pain during pregnancy, before you get pregnant, ensure you've got good glute and core strength. During that first trimester, often when we don't feel like doing any exercise, ensure you're doing your correct pelvic floor TA activations, doing your core strength exercises like what we teach. Do the No More Mummy Tummy Challenge, get on the Fit to Birth Mum program as soon as you find out you're pregnant, to start to prevent all of this. Because once it gets painful, then that's when it's very, very hard to try and compensate, to try and change exercises throughout your pregnancy. We can do it, but then reducing the pain once you're pregnant is harder than preventing it, okay? And often we don't want it to ever get to the stage where you can't walk, okay? Sometimes also as well, you can do all the management pre and then still get the pain. It's very, very hard often during second pregnancies when we're looking after babies, doing all the housework, moving around, and that's what can increase the pain regardless of the exercise we do. Okay, so what we need to try and do, I'm going to just give you a couple of tips before I show you some exercises, girls, okay, is keep your hips together as much as possible. Standing on one leg, okay, is a no-no once you've got the pain and any symptoms. Okay, things like vacuuming, no. Any separation exercises of the hips need to be avoided. Walking lunges, alternating lunges, walking. Okay, now what I found with clients who have come to me with this is that if they reduce and take out these exercises for 2 to 3 weeks, work on the rehab exercises, then they can often start to bring it back in. What you also need to watch out for is stepping out the car. Ouch. Okay, this is with the pubic symphysis pain, stepping out the car, very, very painful. Okay, sleeping at night and getting out of bed. Now let me just show you one tip. Okay, if you have any pubic symphysis issues or the sacroiliac joint pain, back pain, it's often better to sleep with the pillow between your legs like so. So you're keeping your hips together as opposed to sleeping in this angle with the knee forward to give baby more room. Okay, so it's often better, that's a big tip for you, to put your pillow between your legs there so you're not getting that separation through the night. Okay, so play around with that. Okay, again, it's going to be different for everybody, but I found when I got a lot of sacroiliac pain last year, I've been through this, gosh, it must be so hard through your pregnancy to deal with, that I have found sleeping like that, keeping together, is much easier. Okay, if you have to bend down, okay, for anything, which is I'm going to show you, it's a narrow squat. Okay, it's here. Okay, so keep a narrow squat and down, and often stick your bum out a little bit more as well. So you're going down like this, and you're not going down deep through the middle. So bum out, and pick up with those legs together, thinking about that core activation. Now, a couple of exercises what I'm going to show you to do. This band is your best friend when you've got back pain and sacroiliac joint pain. There are so many exercises we can do, girls, with this exercise. So I'm going to show you 2 or 3 exercises today. Okay, and please make sure you spread the word to your friends and family, who are pregnant, girl, anybody who's got any back pain, to come onto the website, have a look at everything. Obviously, if you're suffering from back pain for more than a couple of weeks, you really need to get yourself to a physiotherapist so they can assess you more individually. Now, once you've got pain, now these exercises are fine, if you haven't got pain, they're actually going to reduce it. So great for everyone to do pre and postnatal. Now, I've found you can't do this, okay, and step into it. Ouch, ouch. That's going to create pain if you try and step into it like that, okay? So the best way is, same way as you're going to put your socks on, is you're going to have to be seated, okay? Legs together. Any separation is going to cause pain. Try and remember that, everybody. Okay, so from here, you can lean forward then. That shouldn't create any pain. And pop it around your legs, okay? And here is where we're going to start the first exercise, okay? There's got to be a lot of pressure on. It's got to be quite tight. So when you squeeze out, you're actually, so if you can see me here, so when you squeeze out, you're not actually taking them out wider than your hips. So if you've got a lot of pressure and tension there, when you squeeze out, see? I'm not actually taking it wider than the hips. This is going to be great for those of you who've got back pain, okay? And again, you're going to have to play around with it with the SPD pain. Okay, so what you can do is mini squeezes here and just a small squeeze. Put your hands in your glute medius, which are here, okay, glute medius, and ensure it's that move. It's almost like you're not moving, you're just thinking about those glute medius activating. 3 sets of 10 of those with my, now, tension's got to stay on all the time. Okay, so get ready. You're going to do a stand-up squat, keeping the pressure on glute med. So you go from here, breathing in. Get ready. When you exhale, start to exhale and contract your pelvic floor TA before you move. And you come up. You should feel no pain, no discomfort. You can feel your glutes are switched on. Okay, so it's 10. Slow. Exhale. Okay, keep the pressure on. The band should never go lax. And again. All right, so up you go. Perfect. 2 exercises there for you. One more exercise I'm going to show you now. It's a little bit funny because I've got the different videos going here. So let me just bear with me while I just turn this one around, girls, on Facebook. All right, let me see if I can turn this one around. Ooh, turn it on top. Close up of me there. Okay, right. I don't want to lose you guys at the bottom. Just bear with me. Okay, so I've kept this on. All right, I'm keeping the band on. I'm just coming further back. Okay, now this next exercise, remember everything is slow, okay? Slow, basic contractions, no pain, and you can work alongside a physiotherapist. And again, the whole module is going to be added to the Fit to Birth Mum program. Now come down, 4-point kneeling, and up. Any stage 3 pregnancy, because and postnatal, you're going to have good core activation here. And all you're doing is the start of a push out. Now, if you have no pain, you can go out all the way, and we're trying to get that glute fired up. Okay, so if you can, push out to there. Okay, so you've got a straight leg, and you're going to get some resistance on that. Now, what you do need to be careful of, those of you who have got the pubic syn first, this may just be too uncomfortable, so we work on the other ones. Remember, we're also always working within your pain. We never work with pain or discomfort. So you push out. So there's 3 exercises there. This glute should be really fired up, okay, which should reduce any discomfort and help you to start to improve your core and glute strength without increasing any pain or any discomfort. All right, so please remember, those of you who are suffering from any pain, and you can get this pre and postnatal, keep everything together. You keep your legs together like this, okay, as much as possible. It's going to reduce and prevent the pain. Now, another tip I want to suggest is, often you are told, it's good to sit on a Swiss ball, a fit ball during your pregnancy. But if you have any pain, when you sit down on the ball, it could just cause everything to separate, okay, even further. So, and long periods on that with pressure may not be suitable for you. So play around with, especially if you're sitting in an office all day, you may just have to play around with your chairs a little bit. Often it helps to sit forward. Okay, so sit forward a little bit of your chair. You can take your band in as well, and just think about that placement, everything together. Okay, and then hopefully, you can reduce the pain if you've got it now during your pregnancy and postnatal, and then you can get back into better exercises. You can get back to your walking for the rest of your pregnancy and soon postnatal. So remember, core and glute strength is the most important to prevent. Once you have this pain and discomfort, it's also really important to continue with your core and glute exercises. And there's always alternative exercises that I can suggest if you have got the pain, and there are 2 in the pre and the postnatal programs that you can get on the website. Now remember, because you've been watching the coffee chat, you're entitled to a 20% discount on our programs with the coupon code COFFEECHAT, which you can use on Fit to Birth, Birth to Fit Mum, or Super Fit Mum. So I hope you enjoyed today's coffee chat segment. Okay, everybody. So, oh, sorry, yes, you did miss the glute exercises. Okay, everybody, so get to the website. Okay, pregnancyexercise.co.nz. I'll see you all on Thursday on Facebook for our 6-minute live, which is suitable pre and postnatal.